All right, we're going to go ahead and jump right in and get started as folks are joining. My name is Kate Tingley, and I am the Director of Marketing here at Infinix. This week, we are privileged to be joined by Danielle Buckley, who is our Senior Client Services Manager. Danielle actually has a really interesting background in that she was the practice manager for a cardiology practice for more than 15 years. So she's definitely kind of been on both sides of the spectrum. And this week she's going to share her expertise on improving operational performance to help increase revenue. So thanks, Danielle, for joining us, and let's jump right in.
Thank you.
So what do you see as being the biggest operational challenges that practices face today?
Well, of course, right now there's issues with people trying to find people in, hiring staff, finding the right people, training them. So I think that's where it starts is, getting the staff that you need in the practice. And then as far as the challenges is, as far as when it comes to making sure that your claims get paid, is what is your front desk doing? Are they obtaining, when from the start, when they answer the phone and scheduling the appointment, are they obtaining the correct patient information? Are they verifying the eligibility and benefits before the patient shows up? And when the patient is in front of them, are they getting copies of the insurance card? And I'll always, inform the clients to make sure that they get front and back, because it's very important that there's information on both sides that you need. But I think that's, the authorizations and referrals, knowing when an authorization is required, and if there's a portal to obtain authorization, and just all of those are the operational challenges that I see.
Okay, cool. That's helpful. Thank you.
Mm-hmm.
All right. What do you think are the most common mistakes that practices are making on kind of the front end of the revenue cycle, patient access, space? What do you see as being the most common errors that could be fixed easily?
When we attain new clients, the biggest errors that we see is not obtaining the insurance cards, staff entering the wrong information. Medicare just, a year ago changed their Medicare numbers from their social to their Medicare number. And so you have to get that new Medicare number. And a lot of these patients, they still have their old Medicare number. And so there's portals, that we can use. But getting the proper insurance information and patient information is number one. If you don't have that, your claim's going to deny. If you don't get authorization, your claim's going to get denied, or a referral. So you just want to make sure that that's really where I see a lot of the errors are.
That's a really good point. Let's talk about authorizations for a second, because you mentioned that. And I know when you and I talked a little bit before, it's a big hot topic right now. And yeah, talk a little bit about your best practices for authorizations to avoid denials.
So the best thing that I've seen is do not take the payers. Do not call the payers and ask if authorization is required. A lot of the insurances now have portals that you have to obtain the authorizations through. And so the insurance company, when you call to get the patient's eligibility and benefits, you will ask them, is pre-certification required? They will tell you no. I just had a call on Monday. There was a patient that needed to have this surgery, and the patient had Humana, and Humana uses Health Help for you to obtain the authorizations. My client called me with Humana on the phone, and Humana saying no authorization is required, but we have a denial for authorization from Health Help. So I asked the rep, and I said, how are you telling me that no authorization is required, but Health Help is denying the authorization? How do you not know that you use this third party for authorizations, and you're telling us no authors required? And if the provider's office doesn't know any better, they're going to take that and go do the procedure on the patient, and it's going to get denied because no authorization was obtained. So knowing what portals to go to for each insurance, because a lot of them have gone to portals to get the authorization, the first step is to use portals. If there's not a portal available, then yes, I mean, the only other option is to call. But first step is portal, because you have documentation. If it says no authors required, you can print it out or upload it into the system, and you have that information right there. So if the claim gets denied, you can fight it.
It's a really good point. Can you provide some best practices around scheduling, eligibility? Talked a little bit about prior auths. Just some other best practices that folks can use to avoid those dreaded patient access denials that are a nightmare for a lot of folks right now.
Yes, and again, I'm going to go back, verify the patient's insurance before they walk through the door. That's number one. Number two is, knowing what requires a referral, or what plans require referrals or authorizations. Those are the two major issues that I see, because if you don't get an authorization, you are not going to get paid. And so I think that is the priority. And so your front desk staff is that's where it starts. The scheduling, the front desk, that's where it starts. If they get anything wrong, it's just a trickle down effect. So you've got to make sure that your staff is trained to know. And then also you have to know, some of the staff may not know that there's portals available. And then you have some staff that only know what they were trained to do. And then they may not be a staff member that thinks outside the box. Oh, let me go Google to see if there's a portal that you can use.
That's a really good point.
Yeah, so it's, and everyone knows you got staff that are there for a check, and you got staff that are there, that really care about their job, their practice, the patients. And so because what happens is they're trained by whoever trained them, and it's just the same over and over. And I know you hear people say, well, that's how we've always done it.
Yep.
That's how we've always done it. So they don't know any different.
Yeah, so common in healthcare to hear that response. We've also heard from a lot of clients over the last couple of months, last 6 probably, with all of the staffing challenges, that they're so short-staffed that they're seeing more errors being made because everybody's moving so quickly, and it's causing denials because a name wasn't spelled correctly, or the phone number wasn't updated, demographic information, or they asked that question you just asked, is everything the same? Do you have any recommendations on how to kind of audit that stuff? and better train staff around getting the right information and reducing errors.
Yeah, yeah. The hardest part is having, finding the staff and maintaining them. And I think it's happening all over. We've gotten so much new business just because of,
Right.
clients not being able to find staff or, COVID. I mean, when COVID happened, people couldn't get to work, they're sick. And so it's really hard. It's hard for everyone right now because the staff shortage and then nobody wanting to work. But training, I mean, and of course the person training needs to know what they're, they need to know what they're training.
Right.
And so it's really hard. You really want to push the staff to think outside the box. And let them know that just because we did it this way, if you find something different, if you find a portal, hey, let's use it. Let's get signed up.
Right.
Because that's where it takes less time to use a portal than pick up the phone and sit on hold and wait for a representative. So that also cuts down staff time. I'm all about portals. Use the portals.
Yeah.
We had a patient on the schedule for surgery, and we called. It was an All Savers plan. We called and they stated no pre-cert required. So then we called again and they stated no pre-cert required. The patient was scheduled for the following Tuesday. On Friday, one of the staff members was like, I'm going to call one more time. And so she called one more time, and that person she got on the phone said, yes, authorization was required. So it was brought to my attention, and we informed the provider, and they put the authorization in. So, but it was still pending. And so the patient ultimately, luckily the patient didn't have to get canceled, but it was right there. Like it was, we literally got the authorization the same day that the procedure happened. But when I looked into it more, there was actually a portal that they could have used. And when I went and looked at the notes, it said called. And so that's my first, when I see call, I'm like, why are you calling? Is there a portal?
Right.
So, and documentation, you want to make sure you document everything.
That's a really good idea to look in and track that activity. And if you're seeing the same thing over and over again with no resolution, then it's a red flag that probably need to go about it a different way. I also think, we talk so much about staffing challenges on the provider side, but I think we don't talk enough about the fact that payers are dealing with the same staffing challenges, and it makes wait times a lot longer. You've got new folks that are being trained, and it's the same thing that you talked about. If the person training doesn't know the correct policy around a prior auth, then that new person also doesn't know that information. So it just kind of ends up being that trickle down effect. And so just a better reason to use a portal. So,
and that's true. That's very true. I've actually had Network Health send me an email and ask not to call, to use the portal.
Yeah.
And they're starting to see, and they're and they can even see who's calling in, and they will reach out to those providers and say, you're still not using the portals. I'm like, whoa, they've got that.
Wow.
Yeah.
All right. What clinical errors are you seeing that are resulting in revenue loss? What did you see as a practice manager?
The providers not documenting, not dropping the charges. because now EMRs are so sophisticated,
Right.
the doctors can pick their own code. Also you've got to keep the doctors updated on the policies, and that in itself
Right.
is a policies can change every month. And
Right.
so if they want to order a certain test, they have to know, what diagnosis is covered for this test. This is old school back in the day too. I used to have all the policies in a book, and I had tabs for each insurance company. And as the patient was checking out, if they had Aetna, we had the policy for, because we did nukes, echoes, carotids. And so the staff would have to look to make sure there was a covered diagnosis before they could schedule the patient. Now that's old school. And that you just don't have time to do that anymore. And
Right.
so it's really keeping the providers updated. And then we also did not schedule. There's a lot of providers that are doing vein ablations. And so Blue Cross Blue Shield was one of the big areas to where they didn't require authorization, but they required predetermination. And so sometimes that predetermination takes up to a month. So instead of putting the patient on the schedule, we used an EMR system where you could use actions. And so an action would be sent to the authorizations. And then once they got the authorization, then it would go to scheduling, and then scheduling would call the patient and schedule. That way you don't have the patient on the schedule and somehow it slips by with no authorization. And I've also heard that Medicare is going to start going to authorizations. I think it's gotten pushed back for the last 2 years, but I think 2023 they're going to require authorization for Medicare patients. And that in itself, especially for a cardiologist, or any practice that sees, 50% of Medicare, it is, I'm really nervous about that because it's going to be a staff issue there.
Mm-hmm. For sure. So you mentioned that action item. Any recommendations on making sure that document supports the code prior to billing? Just making sure that documentation is there and the right code.
Yeah, and that's keeping the providers updated, meeting with the providers, keeping them updated, what they need to document in their note. It's sad the doctors can't see patients. They have to worry about all this, using a computer to document, and it's really sad, but yeah, it's keeping them up to date with the policies. The policies change they could change every month. And so as soon as you find out, and usually what happens is you don't find out until you get a denial. And then you go look at the denial and you're like, why did I get this denial? And you go look and it's, they now require authorization, or they now don't cover this test for that certain ICD-10 code. So it's really staying up on the policies and keeping your doctors updated.
So I would think it's that, and then also tracking those denials. Right.
Correct.
And seeing what is there a pattern there?
Correct. Trends.
Yep. Trends, even in terms of provider, is there a provider that's clearly causing denials over and over again? Then there's some things that need to be addressed there. All right. Last question I've got for you. What operations, we talked a little bit about raising your hand and asking for help, but what operations areas do you recommend tackling in-house versus working with a partner on? Kind of put your practice manager hat back on, knowing what you know now, what would you do?
Oh, I would for sure I'm going to be very honest. I would send billing straight out the door.
Yeah.
Because you just can't, uh, you can't hire enough staff to stay on top of the claims.
Right.
And it's not just, you got charge posting, you got payment posting, you got denials, appeals. And if you're seeing over 100 patients a day and then hospital procedures on top of that, if you get behind, you're going to stay behind. And so just working on the other side, we attack it, and so I was amazed. I mean, I really was. And so I enjoy seeing what we can do, and us touching, even as a client service manager, I'm over the account. So I'll go and I'll look to see. And it's just so nice to see a note on every claim that is pending, whether it be for medical records, whether it be for prior authorization. And so it's really nice to see an updated note and not that it hasn't even been touched for 3 months. And I see that on every client that we get. And it's really sad because we want these providers to get paid for the work that they're doing. So I think that if I could have focused on the operations more, then of course the claims, it would, it goes hand in hand. The claims would have gotten processed correctly. A lot of payers are asking for medical records, so you have to have the staff to send, medical records. And so a lot of these claims automatic, you send it, they're not paying it until they receive those medical records. And so again, that takes staff time.
Right. What about, we talked a little bit about using your EMR to its full capacity.
Yes.
To help operations. Do you have any recommendations there?
Yes, templates, help the providers. If your EMR has options to create templates for the providers, I recommend that. I recommend, I'm a big user, and I love eClinicalWorks. I'm sorry, but I love eClinicalWorks. So eClinicalWorks you can communicate to everyone, and you can put processes in place inside the EMR, to where if your staff knows what they need to do and who they need to send certain things to, then you could, it really does help. But it's putting those processes in place and making sure the staff understands. I used actions a lot. Like I said, if the doctor checked out a patient, ordered a venous ablation, they would send an action to the prior auth. They would start working on it right away. As soon as the authorization was approved, then it would go to scheduling. And that was just for us to make sure that it was authorized before the patient was on the schedule. And of course, Medicare right now doesn't require authorization. So the staff would know, okay, this is a Medicare patient, we don't have to do that. But if it's any other insurance besides that, then these are the steps that they have to take. So utilizing your EMR is very important.
You mentioned that Medicare move to authorizations kind of looming at some point. I would think that having those actions and those workflows in place now, with your commercial payers, so that that's easily transferable once that happens, is probably pretty important as well.
And I'm actually nervous about I just wish that they would not even go through with that, because it's going to be a lot of work. when they put that in place, because like if your practice is, 45-50% of Medicare, you've got to get an authorization on for any test.
Yeah.
So
Yeah.
it's I'm really scared for that. So
Yeah.
I'm nervous. Yeah.
Yeah. Well, good. Thanks for all that, Danielle. Want to give everybody a chance to ask some questions if you've got questions. So I'll pause here for a minute or so and give you guys an opportunity to put questions in the Q&A or the chat. All right, I'm not seeing any come through, but I say this every week and I will say it again this week. If questions do pop up, you've got my email address, so don't hesitate to send your question over and I can forward that to Danielle and we can get your questions answered between the two of us. I know sometimes you leave sessions like this and things pop in your mind, so don't hesitate to do that. Danielle, thank you so much. This was really helpful and lots of really good information. I hope everyone got some good nuggets to take and apply to their practice. And Danielle, we're going to let you go so that you can get on the road and stay safe. Danielle is preparing for a big storm right now in Texas. So stay safe and we will see everyone right back here next week at 2 p.m. Pacific, 5 p.m. Eastern.
Thank you.
Thanks again. Thanks, everybody.
All right, bye-bye.
Bye-bye.